Here's what you need to know about robotic assisted radical prostatectomy. You are first put to sleep under general anesthesia. The surgery is done inside the stomach through small keyholes. Your surgeon will perform the prostate removal surgery by controlling robotic arms via a console. The keyholes will then be closed with dissolvable sutures at the end of the surgery. After the surgery, you will find some temporary tubes inserted into your body. A urinary catheter will be inserted into the bladder through the penis. This is to help the new joint between the urethra and bladder heal. In most cases, a drain will be placed into the lower abdomen. The drain tube is connected to a suction bottle meant to remove any residual bodily fluids after the surgery. The drain will usually be removed prior to discharge. However, some patients are discharged with the drain. If that is the case, we will teach you how to take care of it at home. Immediately after surgery, you will spend some time in the recovery area where you will be monitored when you are waking up from anesthesia. You will be brought to the ward where nurses will monitor your vital signs and pain level. Usually patients don't experience intense pain and oral painkillers are sufficient. However, do not hesitate to inform us if the pain is not well controlled. Immediately after surgery, you are encouraged to perform deep breathing exercises and leg exercises. This is to prevent lung infections and blood clots in the legs and lungs. Once the pain level is tolerable, we encourage early ambulation and exercises. You should be able to sit out of bed and walk around the morning after surgery. You can be discharged once you are able to move about normally, able to tolerate diet, and are confident in caring for your urinary catheter. What to expect after discharge? One of the most common complaints after surgery is feeling tired. This is expected as you just had a major surgery, and it will improve over time. You might also feel bloated and your clothing might feel tighter, so we suggest wearing loose clothing and walking around the house, which will help you to release gas. You might also notice some urine leakage around the catheter during the first few days. This is common as the bladder is not used to the catheter and is irritated by it. It is also common to notice some pink or red tinges in your urine after walking and bowel movement. It is important to avoid straining and heavy lifting for at least 6 weeks to avoid putting pressure on your wounds. Have light diet as tolerated to help your bowel movements to return to normal. We will teach you how to care for your catheter properly to minimize risks of infection. You can shower, but remember to keep the wounds clean and dry. Do not use any cream or lotion on them as it may cause irritation and infection. Some signs of wound infection to watch out for include redness and swelling, increasing pain, smelly discharge, and fever. If you have any concerns, you can contact our prostate cancer specialist nurse during office hours, or visit the emergency department after office hours. After discharge, an appointment will be made for you to be followed up in clinic 2 to 3 weeks after surgery. During this review, we will assess your progress on healing. A special scan called maturating cystourethrogram might be done depending on the surgeon's instructions. Contrast is injected into the bladder to check for healing. The urinary catheter will be removed if the joint is well healed. After removal, we will monitor your ability to urinate. Almost all patients will have some degree of urinary incontinence after removal of the catheter and may require diapers or pads. Resume your pelvic floor exercises to strengthen the muscles for the leakage to improve. With diligence, most of the patients will be pad-free between 3 to 6 months post-surgery. We hope you have gained a better understanding of the process. Please feel free to contact us if you have any questions or concerns. Thank you very much.